Hello, my name is Katie Henges, and I am the Director of Programs for the Child Neurology Foundation. This video is to give a high-level overview of the Child Neurology Foundation Neurology Social Services Network, and to give you some more background about it. As I run through this, I'm going to talk about a variety of things, but I will start off giving a little bit of background about the vision for the network. Why did the Child Neurology Foundation choose to take on this program? I'll talk about exactly what this network is. What does it mean? How does it work? How do you participate? I will not be giving a demo. The Unite Us platform is private, so we're not able to demo it today. But if you would like a demo, feel free to reach out to CNF and we can make that happen. I'll talk through next steps, and then we won't do Q&A, obviously, because this isn't live, but feel free to reach out to me directly. My name is Katie Henges, and my email will be on the last slide. So high level, why did CNF choose to take on doing this network? So as a little bit of background, a few years ago, CNF started hosting workshops for patient advocacy organizations to learn more about how to host and run peer support programs. So CNF has our own peer support program that we've been running for many years. Lots of patient advocacy organizations need to run some type of patient support system or program. So we wanted to help them understand how to do that. And the feedback that we were getting from these workshops was, these workshops are great, but I actually need the tools to implement this. I don't necessarily need to understand how to do it. I need the support to do it on a day-to-day basis. So we took that feedback and we thought a little bit about how we could better support other organizations in doing programs similar to ours. So we went out into the community and started looking for technology platforms that would help us do this. And there were a few different things that we were envisioning in what we wanted from a platform. So from our perspective as an organization that provides peer support and other financial support, digital resource support, various programs, we wanted a system that could act as a CRM or a customer support system of some kind. So anyone who's working with families or patients or clients would have a way to easily track all of the data about the people that they work with. And then we also wanted something that would help us aggregate data as a community. So the CNF mantra is rising tides lift all boats. We truly believe that we are going to go farther together as a community than we would as individual disease state organizations. So we wanted a platform where not only could we manage our own communication with the people that we work with, we could aggregate that communication together. Could we better understand across all of our organizations the types of people that we're working with and the types of needs that they have so that we could share that data externally as one community? In order to do that, we wanted to find a platform that would support local resource navigation and national resource navigation. We also wanted to provide wraparound support. So what we find at our organization is when we provide peer support, we're not only providing peer support, we're also almost acting as professional Googlers and helping people find the resources that they need. And that is a pretty heavy lift to be managing for lots of folks reaching out to us. So we wanted to find a system that would give us the ability to find the resources that people need quickly and get people to them effectively and efficiently. We want to know that those families land in warm hands and they get taken care of as quickly as possible. They don't just sort of disappear into the void. So we wanted a system that would help facilitate that. And we knew that there's lots of technology and innovation out there that could be done and used for this type of purpose. So after all of those discussions and all of that background, we ended up settling on partnering with an organization called Unite Us. Unite Us is an online social services referral platform that does all of these things for our organization. So as a little bit more background about Unite Us, who they are and what they do, they are an online platform that anyone can access via a browser. They have social service networks in 42 states across the US, and by the end of the year they will be in all 50 states. So they actually go into the states, and usually with funding from the government or a health insurance company, they connect all of the social services within that state. So food shelves, transportation assistance, hospitals, clinics, mental health facilities, you name it, any social service organization can join and be connected. Those organizations can then refer to each other within the state. They also have the opportunity for national organizations to connect on a higher level and connect down to all of these individual state-based networks. So what we decided to do is partner with Unitas for a year-long pilot program and invite 30 other organizations, national patient advocacy organizations, to join the platform with us, where we can connect to all of these different state networks, but then aggregate our data together on a national level. De-identified, obviously, we're not going to be able to see each other's individual patients or anything like that. So we're looking for 30 organizations. At this point, we have about 15 that have already registered, so we're looking for 15 more. This is as of April 13th. But we will onboard those organizations over the next couple of months, and then we will work together to aggregate our data over the next year and see how it goes. We would then host quarterly conversations where CNF would share out de-identified data at an aggregate level about all of the different needs for families at all of our organizations. If our hypothesis is correct that all of the families, no matter their diagnosis, have the same needs, we're going to have a much broader impact and much more powerful impact when we aggregate that data together and talk with state or federal organizations or policymakers, things like that. So over the next year, we'll evaluate the effectiveness of these networks and how we use it and how we could potentially expand in the future. So while we will be able to connect and do direct referrals within 42 of the states immediately, there is a price point associated with actually aggregating data on a national level for all of our organizations per state. So what we decided to do is we selected 30 states that initially we want to aggregate data in. So we can refer patients and families to any network across the US, but we selected 30 where we would be able to aggregate data together. So there were a variety of things that we used to select which of those states they would be, which are listed here. And this slide just gives an overview of which of those states they will be. So again, those states that are in blue are the ones where on a national level, all 30 organizations can aggregate their data together. But there are other states in here, even if they are in black, that we would still be able to refer families to the social services in that state. So because of this, there is a small fee for participation for national patient advocacy organizations to join. CNF does have some sponsors for the program initially, but it does not cover the entire cost of the actual Tableau environment that is required to aggregate our data. So if people are interested in joining, there will be a small fee associated with it. For full transparency, any 501c3 in the United States can join and use Unitas as an individual organization for free. So if you wanted to, you could go in and just test it out for free, go for that direction. But in order to actually aggregate our data and make a difference and really get that volume out there to better understand what the needs of our community are, there is this small price point associated with it. So fee scale is based on the annual revenue identified in the 2020 or 2021 990, depending on whichever one is completed and filed when you apply. This amount the charge will never go above 0.33% of your organization's annual revenue. So that price point can actually go down depending on the scope of your organization, how large your organization, how many people your organization serves. So there is definitely room there for discussion about what that price point would be. For organizations with revenue under $200,000, it is free to participate. And like I mentioned, these partner fees are going directly to paying essentially for the Tableau environment where we would be aggregating data together. In the future, once we're done with the pilot program, there will be probably a higher price point for participating in this network, but anyone who joins in the pilot phase would get a much cheaper price point in the future. So if you're interested in a demo of the platform and what it looks like, feel free to reach out to CNF and we would be happy to set that up. But what next steps look like if you're interested in joining are an organization can fill out an application, which includes giving us a little bit of information about who you are and the services you provide. CNF will decide if, based on what you've submitted, you are able to join the network, if it's actually applicable to you. We'd schedule a meeting with us and Unitas to talk through that information and how it works. From there, we would sign an agreement just to establish a relationship with your organization. And then moving forward, once the agreement is signed and you're ready to go, it's usually at a 4 to 8 week process to get your organization up and running and using the Unite Us platform. The platform is customized to the needs of your organization. So depending on how many customizations you want, it can take a little bit longer, but we just finished it and it took less than 6 weeks, which was great. And then you can launch and use it as you wish. So feel free to reach out to me. Again, I'm the Director of Programs, Katie Henges. My email is khenges@childneurologyfoundation.org. And I look forward to hearing from you.